We come live to you each and every Saturday from 2 p.m. And of course, you can interact with us on our social media handles, Facebook, Instagram, Twitter, TikTok, tuko E_squared TV, ama Eastlands Expressions. Now, let's talk baby care. I'm joined by a beautiful lady. She's very beautiful. She's a pediatrician at AAR Hospital. And of course, I'm here to learn, and I know you're here to learn as well. So we're going to discuss some of the things that you need to know as a first-time mom, and of course, creating that safe environment for your newborn baby, and of course, for your baby as well. Thank you so much, Wambui. Wambui, I was told it's what.
Yes.
Thank you so much to the show.
Welcome. Thank you very much for
Oh.
welcoming me to the show. My name is Wambui Wanyoike. I'm a consultant pediatrician, and what that means basically is that I deal with small babies. So I deal with babies from the time they are born until they grow up, when we are giving them the vaccine, when we are feeding, as they grow to adolescent, and then release them once they get into adulthood.
Okay. Is this something that you always wanted to do?
I can say something I always wanted to do. What I actually wanted to do was just to help children. I used to live next to a children's home, and I used to go and volunteer. It was a home for abandoned babies, either because they had malformations, because they were HIV infected, and parents would disown them. So I'd go and actually volunteer, help wash them, help feed them. And with time, I had a bond for these children, and I wanted to see how best I could help them. Initially, I thought the church would be the best way to do so, but after a while, I realized I could help them and create a bigger impact by actually becoming a baby doctor. And that's actually how I kept on focusing my goals to become who I am today.
Wow, wow. How would you say it has been for you so far?
In terms of the journey to being a pediatrician,
Yes,
it's been a great journey. It has had its challenges. Remember, you need to complete high school. So that is a challenge already on its own. And after that, joining university. So when I did my medical school, it was about 5 years. I think now it's 6 years of medical school. And it does have its challenges. Sometimes you feel defeated. Sometimes you have to rewind a year, or you get like something we call a supplementary, where you need to redo a certain course or do a certain exam again. And this can be disillusional for some people, but I'd like to encourage people to keep on gearing on. And after that, I did my internship. And after that, I decided I want to go back to school. And then I did another 3-year program to specialize in pediatrics on its own. It's been a great journey. I've managed to work in the private sector, I've managed to work in the public sector. So in terms of the private sector, I'm now at AAR Hospital, which is just here on Kiambu Road.
Okay. So a fun question of the conversation for a little bit. You've talked about some supplementaries, and I like to quote something, or rather just state something. When we talk about supplementary, inakwanga the normal thing, okay, fail exam, you have to redo that unit. You just do an exam. So for medicine, is it the same? Ama you have to redo the whole unit, the whole semester?
For the supplementary, it's actually the same as what you said. So a supplementary is just a supplementary exam.
Oh,
yes.
Okay. It's nice to see you again. Are you still volunteering though?
I try and do volunteering in terms of medical camps or visiting children's home. But most of the time my work is in private work. But if I get an opportunity, I'm more than willing to actually get into volunteering work.
Okay. Okay. So I like to, this month we're having a conversation on baby care, the basic things that I, as a first-time mother, someone who wants to be a mother, needs to know about taking care of that baby the right way. And of course, just creating that conducive environment that is able to accommodate the child and help you as a mother raise the kid well. So just to start with the basic, what are some of, before we get to the basic, you're a mom. Congratulations.
Yes, I am. Thank you.
Congratulations.
Thank you.
Anaitwa nani?
He's called Ave. He's 3 years old now.
Wow.
He's a little boy.
Congratulations. I hope. Okay, he's not watching. But
You better be watching.
he will definitely watch after this. So how was it? How was it for you being a first-time mom, being a pediatrician? How did you juggle in between? What are some of the lessons you also learned along the way?
So most times people think being a doctor or being a pediatrician, you know what you're doing. And unfortunately, that is not so. A first-time mom is the first time you're actually being a mother, and so you're on ground zero with everybody else, trying to learn and try to navigate yourself through this new experience. So my challenge was, a main thing was breastfeeding. So just thinking everyone is looking at me as a pediatrician, I should know what to do, because this is something I tell people on a day-to-day basis. But I found myself struggling as well. The main thing, just latching, having enough milk, making sure you don't have nipple pain and cracked nipples, having engorgement, all those challenges that mothers go to, we're not immune to them. We actually go through them and learn with other mothers what exactly to do. Being a mother is not something that's inbuilt. Breastfeeding is not natural. It's something that's learned both by the mother and by the baby. And that's why I encourage a lot of my parents and just keep on encouraging them, and also the people around them, to encourage them that this is something that they need to learn together. So that was one of the main challenges. Other things is having an unwell baby in the home. Fine, I'm a pediatrician, but I can't treat my own child, so I have to go to a hospital. I have to find out what the signs are that I have to look for sometimes, and also recognize them early and not treat my child at home and actually go to the hospital to seek help. So these are things that another mother and myself will go through the same way. It's just seeking help and seeking a healthcare provider's advice.
Other than seeking healthcare providers' advice, what are some of the things that I should do as a first-time mom when I experience breast encroachment and I'm not able to produce enough milk for my baby?
So most times the issue is latching. So when you first deliver, the healthcare provider, be it a midwife, be it a doctor, we try and go that journey with you, because the main thing the child needs to do is breastfeed. This is feeding, right? We feed 3 times a day. A child doesn't. So we need to teach them. Babies need to feed every 3 hours. Most times we say 2 to 3 hours. If the baby passes 4 hours, please wake your baby up and breastfeed. The more you breastfeed, the more milk supply you actually get.
Okay.
Then we really try and teach you on latching, because latching is when the baby comes to the boob, and you have to make sure, 1, the mother doesn't feel pain. 2, the baby is sucking properly to be able to get enough milk without causing the mother pain. And also, the sucking needs to be enough for the baby to get enough milk and get satisfied. So there are different techniques that we teach the mother to do so that it's comfortable for her and baby. We make sure her herself, she's comfortable in how she's holding the baby so that she's able to breastfeed efficiently.
Okay.
We also encourage the mother on nutrition. So feeding, I know people will try and give you all the njahes and all those things. What we encourage is adequate nutrition, meaning the mother drinks enough water. It could be in form of water, it could be in form of cocoa or chocolate, it could be in form of uji and soup. Just adequate hydration is very important. And in terms of meals, the food that is there, eat enough. Don't eat excess. Don't eat less as you're trying to lose weight. Breastfeeding is actually a weight loss method, right? So just try and eat an adequate amount for you to be able to produce enough milk. Sometimes your doctor may recommend some supplements, either in form of tablets or some powders, but make sure you seek a healthcare provider's advice before you take anything, because everything you take is passed on to your baby through the breast milk. So it needs to be safe for you and safe for the baby as well.
Okay.
There's some natural products out there, the fennel seeds, the dill seeds, the lactation cookies and tea bags if you want to, but just an adequate hydration, your fluid intake and your food intake is actually enough. Then remember, mothers need plenty of rest. So I'd encourage people around them to support them so they're able to rest. When they rest, they're not anxious, they're not stressed, they're able to produce enough milk.
Okay. Is there a number of time that I'm supposed to take meals, or am I just follow the obvious 3-course meal?
Eat when you're hungry. Eat when
Okay.
you're hungry, but make sure at least you have your 3 times a day meal, and maybe a snack maybe at 10 and at 4, but make sure throughout there's a bottle of milk, of water there, or some cocoa that you're sipping on throughout. Remember, you're producing a lot of milk. It's fluids that you're also draining yourself of, and you're producing a whole meal for a human being.
Yeah.
So you need to make sure you're hydrating adequately. Plenty of fluids.
Okay. So what of this case when I have a child and the child does not want to breastfeed, and let's say there's an alternative for baby formula. I cannot afford baby formula. What do I do in such a situation?
So as a healthcare provider, I'd like to know first, why is the baby not breastfeeding? Is it an issue of latching, meaning the baby is not putting themselves on the boob and sucking properly? Is it how we are holding the baby? Is it that there's not enough milk? So all these things need to be assessed by either a doctor or a nurse or midwife, so we're able to support you in that aspect first. Sometimes those are usually the main reasons. Some parents say maybe the child prefers to take a bottle than the breast, and there will encourage the mother to express into the bottle and give the baby the breast milk. Remember, breast milk is very, very important. It has so many benefits. 1, it's safe, meaning your child is able to get this milk without getting any diarrheal diseases. You're not mixing with water from the borehole and in a different bottle. So it's safe and baby is able to get it really fast. So it's readily available. It's not something you need to go and buy. It's not something you need to warm first. So when the baby wants to feed, they feed immediately. And it's reliable. So sometimes when you talk about formula is very expensive. In the beginning, someone might think, we only use 1 tin a week. As the baby grows older, the demands increase. So you end up using 3 to 4 tins in a week. And the price is quite high. Most formulas range from about 800 to 3,000. If your baby has special needs, it can go up to 15,000 a tin. So we really try and encourage mothers to breastfeed from the get-go. Breastfeeding has its benefits in terms of antibodies. Mother has this antibody she's produced. Maybe she had an infection, so her body builds as an immune system, and she passes it on through her breast milk. And the baby gets this immunity. Remember, they don't have an immunity.
Yeah.
Now, they also have this immunity to fight other infections. So they're able to stay healthy for longer. It's also bonding between the mother and the baby. Mom and baby need to bond. I know they've been together for 9 months, but in this other period, they also need to bond. And it can reduce incidences of also postpartum depression. For most people, if that is reduced, even incidences of child abuse also actually go down. So it's also very, very important. So breastfeeding has its benefits. On a case-to-case basis, it's something that we can discuss if mother needs to get an alternative, but breast milk is actually best. For mothers who are not able to breastfeed, we can still support them. It doesn't mean that they're a failure. And unfortunately, society has built that around mothers, that if you can't breastfeed, then you're not a mother. Yeah, and that is unfortunate that we have actually created that kind of environment. Despite trying to encourage breastfeeding, let's support mothers who either were not able to breastfeed, either because they were unwell, they were on medication, or the process just didn't work well for them, either because we didn't support them or there was another issue.
Okay. And when exactly should I stop breastfeeding my kid and start administering this food, kama uji, this kind of stuff?
So as healthcare providers, we encourage breastfeeding at least for 6 months. So the first 6 months, we encourage exclusive breastfeeding. And what does exclusive breastfeeding mean? It means you're not giving anything else, including water. Even when they hiccup, it is just breast milk. Breast milk has sufficient water to actually help with those hiccups and satisfy the baby and provide enough nutrition until they're 6 months. So at 6 months is when we start complementary feeding, what other people call weaning, or when we start foods. And we start on a gradual process, which many mothers have that booklet for vaccines. They should actually have a look at it. It has a lot of information, and they can actually have a look at it and see how to start their foods and how to kind of step up to different foods and different food types and what needs to be in every meal. So that booklet is very important. But breastfeed for as long as you can. I've had mothers breastfeeding until 3.5 years. Breastfeed for as long as you can. It still has benefits to the child.
Okay. So we also have cases of women who give birth at home. And then there are also women who are in the rural areas. How do we ensure that these women are also well equipped with this kind of information the minute they give birth, and they're able to know exactly how to take care of the newborn?
So in our setting, it does happen. It does happen that either a mother is not able to afford healthcare, or has not been able to reach the hospital because of poor infrastructure, and that's very unfortunate. I'd like to encourage mothers at least to attend the antenatal clinic, because during the antenatal clinic, these are things that you are advised on, and the midwives and the nurses actually talk to you about all these things, including your doctor. If you end up delivering at home, please come to the hospital as soon as you can, because remember, we need to check on the baby, make sure everything is fine, support the mother as well, see if she has any concerns, and vaccines are very important. We give the oral polio and BCG at birth. So oral polio is for polio, BCG for extrapulmonary TB. These are things that are in our setup, and we need to protect our children from that. So if they end up giving birth outside of the home, of the hospital, please come to the hospital so that we are able to assist you with that. Assist you with the cord care especially, because this is usually a common site of infection. So we're able to guide them on what to do at home and also the danger signs.
Okay. Talking of vaccines, do you mind sharing with us like the immunization chart? Sorry, there's a way it works. There's a certain age or certain period you're supposed to get your kid administered for a certain, maybe let's say polio or something else. So how does it work, and how important are those vaccines?
So vaccines, as I think with COVID, it's very good to use COVID as an example. It's a preventable illness, or rather, the causes of death from it are preventable if you have the vaccine. So vaccines prevent one complication from the disease and actually death from the disease. So even though you get it, you'll get a milder form and a less complication, and you're likely to survive. So these immunizations have come up, and our immunizations in Kenya are definitely different from other countries because what we're suffering from are very different from other people. Yeah. So the vaccine schedule, we have the KEPI schedule. That's a Kenyan schedule that starts at birth. And it usually covers the whole vaccine schedule, covers for different diseases. So you have the polio, you have tetanus, you have pneumonia, diphtheria, rotavirus, which causes diarrhea, very profuse diarrhea that can get children unwell, measles and chicken pox, meningitis as well. So the one in the government has been able to provide either for free or at subsidized cost. And then you have other additional vaccines, not meaning they're not important, but because they're still important, but they're not in the schedule yet, such as meningitis. And that's when people ask you, are they important or not important vaccines? So the main schedule we follow is the one at birth. Then we do a 6, 10, and 14-week vaccine. After that, we meet at 9 months. And then from there, we have boosters then on. Then the non-essential vaccines that people see, which are still very important, although they're not in our schedule, are the flu vaccines. At 6 and 7 months, we have the meningitis vaccine at 10 months. And these other vaccines have boosters later on. If you check your booklet, they're all there. So I don't think there's anything like important and not important vaccines. There are those ones that are in our booklet, but always ask, is there another one that I can get? Because meningitis is something we've heard about and we've seen what it can cause to children. If you're able to afford it, please get it and ask your provider, when can I slot this vaccine and when do I get the booster?
Okay, thank you so much for that. What are some of the lessons you learned as a first-time mom?
That I don't know everything. Even as a doctor, I don't know everything. It's a learning process. And sometimes you feel like you know everything as a doctor and you refuse to listen from information from other people. Or you feel like you have read this certain blog or you've read this certain article and you're the one who knows best. So I'd have challenges with my mother and grandmother when they try and give me advice. And I'm like, what do you mean? But I'm the doctor. I'm the one who knows best. Yes. And I had to humble down to actually listen to advice from people who had gone through it, to listen to other mothers and pick advice from them. And remember, I'm not alone. Sometimes you actually do feel alone, but talking to people who are going through the same thing as you stop feeling inadequate, because sometimes you look at yourself and you're wondering, am I doing the right thing? Am I a good enough mom? When you talk to other mothers, you realize you're not alone and it actually helps. And then from there you ask, so how did you deal with it? You actually humble yourself to be able to ask for advice and realize you're not perfect. So it's been a learning journey. It's been one that I have managed to get my support in my support group. It may not be the same people you're always with, but you'll find people in different forums that are able to support you.
Okay. And what are some of the basic things a first-time mom should know the minute you walk home with a newborn baby? What are some of the things I need to know or rather do?
You learn on the job, but we make sure before you leave the hospital, there's some things we'll teach you on. One, as I said, is breastfeeding. We've talked about breastfeeding, enough milk, and also in terms of latching. So we encourage you to breastfeed throughout. So one, when you go home, even if the baby hiccups, no water. Another thing we try and emphasize on before you go home is how to clean the cord. So we actually demonstrate you how to clean the cord and how to wash the baby. We try and show you how to clean the cord. Different hospitals have different supplies. So depending on what your hospital has, could it be something called chlorhexidine, which is something you apply on the cord, or could it be surgical spirit, depending. But make sure you've always consulted your doctor or your midwife on what is safe to put on the baby's cord. So we teach you how to clean the cord, how to wash the baby as well, and how to clean the eyes. Another thing in terms of knowing how to breastfeed your baby. So we encourage to feed the baby 3 hourly, every 3 hours. Baby does not drink breakfast, lunch, and dinner. So every 3 hours, baby needs to be breastfed, including at night. Parents get very distressed when the baby wakes up every 2 to 3 hours, but that is actually the normal pattern. And that is going to be your normal day-to-day activity. You'll be up every 2 to 3 hours to breastfeed the baby. Then we talk about diaper changes. This way you know that your baby is getting enough milk. So we encourage the parents between 24 hours. So from 8 a.m. to 8 p.m., ensure your baby has had at least 6 to 8 wet diapers. That means your baby is getting enough. If it's less than 6, going to about 4 or 2 or no wet diaper a day, meaning your baby was not breastfeeding well. Then we advise also on danger signs, things to look out for. So a baby who has a fever, and a fever is a temperature above 37.5. Despite removing the clothes, the baby still has a fever and you don't know the cause. A baby who's not breastfeeding well. So mom puts baby on the breast and baby is not even trying to suck. Or they suck for a second or two and then they stop. Then they go back to sleep. Then you have these babies who just sleep throughout. 6 hours later, this baby hasn't woken up. Or the whole night, you think, today nimepumzika. No, your baby has not woken up, meaning there's something wrong. So a baby who's very drowsy, very sleepy, that's a baby to look out for. So the fever, vomiting as well, a very dull, sleepy baby, and a baby whose diaper changes have really reduced. Those are things to look out for. And we try and advise this for parents when they're going home, because that way they're able to come to us before things get worse.
Okay. Are there any other symptoms that I should look out for before taking my kid to the hospital?
So those are the main things. Okay. There are other symptoms, maybe things that I don't want to scare parents about, but something called a convulsion. A convulsion is when your baby just starts jerking all of a sudden. Sometimes they just lose consciousness completely with some eye rolling. So that's a convulsion, or something that other people call seizures. From the newborn baby, you're worried about the cord. The cord sometimes can start having a foul smell if it's not cleaned properly, with reddening around the area or some sort of discoloration or some pus. That means you could be having an infection. You also need to check how often your baby passes stool. It may not be regular, but in the first times, it's more or less at least daily. If it's not, the baby is not passing any gas as well, you'd like to maybe consult and find out. But most times, babies will pass poop every day. Sometimes they skip a day or two, but you need to watch out. Are they also vomiting? And are they having poor feeding? Please come to the hospital.
Okay. What are some of the, let's say, myths associated with newborns that we practice but have no medical basis?
One is hiccups. Hiccups is something that really scares parents. The baby starts hiccuping, and as an adult, when you hiccup, you're so irritated. Children don't get as irritated as adults do. Most times, the hiccups usually create more concern with the parents. The parents are more, the baby's hiccuping. What do? They need water. No, they don't. Leave the hiccup, it will go on its own. I've seen people putting papers. I don't know if you've seen that. They put papers on the forehead. That is, at least it's harmless. That is fine to reduce the hiccups. What I'd discourage is giving water for the hiccups. As I said, that is now a source of infection to give a baby diarrhea and vomiting. So I'd rather avoid that. You can breastfeed instead. So avoid giving water to babies below the age of 6 months. In terms of cord care, I've seen some mothers use cow dung and saliva, and that may not be as sanitary and may be a route of infection to the baby. So that is one of the traditional myths that maybe our great-grandmothers practice, but I discourage it because of risk of infection in a newborn.
Okay. Are there any sort of exercise that is recommended for newborns, and why are they important?
So in terms of exercise, it's just mainly massaging your baby. Hiyo kukanda. Yeah, it helps kind of relax the baby sometimes. If you have a baby who's not sleeping very well at night, meaning every 20 minutes they're up, every 20 minutes they're up, or you find that they're very irritable, it's something you can do in the evening after the shower. You get your oil and you just massage them. For the tummy, some babies may have colic, or they may have a sort of gas in their stomach because either they pulled in a lot of air when they were breastfeeding. So there's some bicycle kicks that you can do with the baby's legs. You can rub the tummy in a clockwise kind of fashion. The way your clock goes, kind of rub the baby's tummy in a clockwise fashion, just to massage the stomach so they're able to pass gas easily. The rest is just a normal massage. Sometimes they sleep very well after that if you feel that your baby has not been sleeping too well.
Okay. How can I create a conducive environment for my baby? And how do I know this environment is conducive for my baby?
So from the get-go, I think once someone is just about to deliver, it's things that you need to look out in your environment. There are very many sources of accidents in children, especially when they start moving around, which is from about 4 months of age. So at 4 months, your baby starts rolling over from side to side. This is sometimes may catch parents as surprise when your baby falls off the bed, right? Sometimes it may be harmless, sometimes they get a bump, but it's very important to note that from 4 months, your baby will start rolling from side to side. Don't wait for that time for them to drop. Make sure they're always attended to. They're never left on a very high surface, or never left unattended on a counter and things like that. As they grow older, with time, you'll see certain things when they start crawling and moving around, you need to be aware of the things around you. Coins, beads, the foodstuffs you leave around, things like grapes, raw carrots, bread also can actually cause choking in children. So those are your choking hazards. In a house, if you live in a flat, ensure that the doors are always closed. The windows, if they're opened and there's no railing, they're closed. If you have a balcony, stairs, when you're walking with children, make sure you always have their hand held, or you're very aware about the risks of falling. Because falling is very, very common with our high-rise buildings in Nairobi and in other parts of the country. So you need to be very cautious about falls. Something very common is hot water. When your baby starts moving around, you start leaving water, the basin that you're supposed to wash them in, but you put hot water first. As you are going to get the cold water, baby put their hand or their feet inside. So these are things you need to be aware of. On our kitchen counters or on our tables, drinking tea, avoid drinking hot things in front of the children. Try and drink away or keep them at a bay. And then if you have hot pots and pans, ensure when you're cooking, the handle is not facing out, because the baby will just come in, hit it. Or if you have a tablecloth, baby can just come and pull and have hot tea pouring on them. So flasks need to be secure, teacups need to be kept away from the edge. But most of all, if you can, always have someone attending to your child.
Okay. Thank you so much for that. Let me get to the comments. Thank you so much, guys, for keeping it squared. Nancy Bansi, thank you so much for staying tuned. Anasema, Caroline, you look great. Thank you so much, Nancy Bansi. Steve Biko anasema Gloria yako juu tu sana. Thank you so much for staying tuned. Pinches the entertainer. Hi, Pinches. Pinches anasema yuko tuned and he's loving the show. Thank you so much, man. We miss you on this other side. Steve Biko anasema huyu hambia na host lini kwa studio. She will soon. She will. Brother Gota, thank you so much for staying tuned. Anasema yuko locked in. Nancy Bansi again. The art is lit. Thank you so much, Nancy. Hashim anasema awesome. Thank you so much for staying tuned. Remember to subscribe to our channel so that every time we go live, you're able to access our content. Justin Kiboy anasema looking great, Dr. Wanyoike. Thank you for the very informative talk. Thank you so much, Josephine. Steve Biko has a question here. Anasema, when a man is left with the baby, how will he know it's time to feed kwanza kama the baby is not crying?
So most times babies will give you a cue. Remember we said every 3 hours. So if you've been left with a baby, please find out when was the last time the baby fed. And I'm sure mom or someone will tell you the next feed is at this and this time. So ensure you're noting the time. If baby doesn't wake up past 3 hours, 4 hours, at hour 5, please wake up that child and make sure they're okay. Most times babies have cues. These are signs they give you when they're hungry. 1 is crying. 2, they'll probably wake up from their nap. For the small babies, they have certain reflexes that they show to show you that they're hungry. So if you put a cloth next to their mouth, they'll try and move towards the cloth and try and suck on it. And that will tell you the baby is hungry. Sometimes they actually even suck their hands. And that's actually a sign or a signal that baby is hungry.
Okay. Thank you so much for that. Josephine Dungo. Hey, Josephine. Thank you so much for staying tuned. Josephine, this is a very useful information for new moms. Love it. Glad you love it. Thank you so much. Michael Black. Hi, Mike. Thank you so much for the comment. And what symptoms should we take seriously in newborn to seek medical attention? I think we answered that. Josephine Dungo has a question. What will happen if a parent misses a vaccine that is required on the KP schedule?
So that's a very, very important question, especially with Corona. Many parents did not come for their vaccines because of fear of their children and themselves also getting the infection. So as a healthcare provider, that's why we tell parents, always come with your booklet so we know what you've missed. And that way we create a schedule on how to get a catch-up vaccine. We call it a catch-up vaccine. Okay. So vaccines are spaced out in certain weeks or months. And that way, once we give you the vaccine, we give you the vaccine as soon as we have an encounter with you. We realize it's been missed and you have your booklet. Once we give it to you, we'll continue the same schedule in terms of the intervals apart. So if the vaccine was supposed to be 3 months apart, after 3 months, you'll come for the next vaccine.
Okay.
So we can always catch up depending on when we lost you in terms of the vaccine schedule.
Okay. Michael Black, another question. Are there any sort of exercise recommended for newborns? My grandma was a pro baby. All children in the village were brought to her. I think we've answered that. Thank you so much for the comment. Mike, Steve Biko, I have seen babies covered on a very hot day with a mother, is it recommended to do so?
No, it's not. I see it a lot happening. I think parents are very worried about that upepo that
Yeah.
passes. What to encourage parents, whatever you're wearing on a hot day, because mom is there in a nice dress only, no jacket, no hat, but the baby has been covered with 3-4 layers and a kaboshori, and the baby is actually very uncomfortable. And even for us, if you think about it, wearing a jacket on a hot day is not ideal. We encourage parents, whatever you're wearing, put your baby either 1 or 2 layers extra.
Okay.
If you find your baby sweating, it's a sign that they are hot. Listen to it and actually undress them. Take them out to enjoy the sun as well. Ensure it's not too hot. So we say before 10 a.m. and after probably 2-3 p.m. when it's not burning sun. But we encourage parents to be very aware about sweating in their babies and a too hot day. Let them be comfortable as we are comfortable as well.
Okay. Just been doing another question. How effective is the flu jab? The flu jab.
So the flu vaccine we give at 6 months and at 7 months, and then after that we give it every year. So every year it changes based on what bug or what bacteria or virus is circulating in our environment.
Okay.
It's important in preventing flus in children. Remember, when they go to school, they're exposed to all these flu bugs, and also the ones who come home, the 6-month-old maybe didn't go to school, but will get it. So it, as we said, vaccines reduce the severity of the infection you get. So it doesn't become so serious, and may also actually help you prevent being admitted to hospital as well. For children who have risky airways, they have maybe asthma, or they have some deformities or effects that they had on their lungs, the flu vaccine also helps them and prevents them from getting frequent infections that may affect the lungs. So the flu vaccine is effective.
Okay. Nancy Bansi, I've seen your comment. What happens when a mother lacks breast milk, then instead gives the child normal milk?
So that's on a case-to-case basis, and that can actually happen. It does happen to some mothers for whatever reason. As we explained, the reason sometimes a mother may not have milk and may have to look up for alternatives. Usually, as pediatricians, we're concerned about the proteins in the cow's milk, maybe, or whatever milk it is, maybe it cause an effect in terms of allergies in the child later on in life. Also, in terms of the nutritive value, remember the nutrition in mom's milk is very good, and cow milk, we kind of say cow milk is for cows.
Yeah.
Yes. So we try and encourage mothers as much as possible. If you're looking for an alternative, look for something that is safe, reliable, and also as close to mother's milk as possible. But on a case-to-case basis, I'd encourage parents, if you're not able, and if that is the only solution you have, talk to your healthcare worker. We see how we can be able to make sure baby still gets the adequate nutrients they require.
Okay. Michael Black, another question. What is so special in babies that they can't touch? They can't catch, sorry. What is so special in babies that they can't catch coronavirus?
So those are just studies. As you said, corona, we're still getting to know it. I don't know if we've gotten to know it yet, or it will leave us before we get to know everything about it. But children have been a spared population from the newborns, even newborns who have been born from mothers who are corona positive. Some of them have actually been negative. And if they're positive, they've been lucky not to get serious infections. So it's just something that's still under research, but we've been very, very grateful and lucky that they have not been affected as much as adults have.
Okay. Before I let you go, 2 more questions. What advice will you give to young moms, first-time moms, who are on the lookout for forums that are basically meant to help them get to understand how they need to take care of that child, also understanding the journey, the pregnancy journey through, after, and before?
So I'd encourage mothers to reach out to friends, to family, to be able to get this advice. There's a lot of material out there. Be very careful to filter what is important, what is true, because there are a lot of myths out there as well. And then there's also information that will make you feel inadequate. So make sure to reach for information that will actually help you be a better mom and not feel worse about your journey. Try not to compare. Everyone's journey is different. At the end of the day, what you just want is a healthy baby, and you want to push them to be the best. So just be the best that you can. There are different forums. If you go to hospitals, I'm sure there are groups that are there available in different communities. Reach out to them. Reach out to friends who've had babies, and also try and look for people who have babies the same age group as you. That way, as you go through challenges, you go through them together, you encourage each other, and you learn from each other.
Okay. What do you love about being a mom?
It's amazing. I don't even know how to put it in words, but it's the best thing I've ever done in my life. It's been rewarding. It can be challenging. Sometimes you're with your baby and you're wondering, this is so much work. then they fall asleep for 5 minutes and you want to wake them up and just spend time with them. It's a very weird feeling. It's been eye-opening. It's made me a better person. It's made me a better doctor as well. It's made me a better friend to people who have children as well. So I'd say being a mother has made me a better person overall, and I love it and I'm grateful for it.
Thank you so much for your time.
Thank you so much, Caroline. I really enjoyed it.